I'd also like to give a little validation of our use of the combination of phentermine with a small amount of Prozac, as was initially described in 1994, recommended by Michael Ankers of Gaithersburg, Maryland, who's I consider a friend and has been very helpful in our use of the combination of phentermine with Prozac, or Phen Pro, that he first recommended in 1994. It has never received proper credit for that, as well as warning of the dangers of fenfluramine before it was taken off the market 3 years later. I found fairly recently, actually this would have been in December of 2000, there's been a study done by the National Institutes of Health. This was printed in the medical journal Synapse. It's SYNAPSE 2000, the year 2000, December the 15th. The article is entitled Fluoxetine, that's Fluoxetine, which is the generic name for Prozac, increases the anorectic. Anorectic means it decreases hunger, and the long-term dopamine depleting effects of phentermine. Dopamine, again, is the brain chemical associated with addiction, and we are seeing this more and more in processed foods, that the cause, in our opinion, of our obesity epidemic and overweight epidemic are the processed foods, which have been altered with optimal amounts of additional salts, sugars, and fats to cause us to overeat. But this particular study, again, that was printed in Synapse, as done by the National Institutes of Health, shows that the addition of the Prozac does help the anorectic or hunger suppressing effects of phentermine. Additionally, Dr. Ankers, who owns a patent on the combination of phentermine with Prozac, but because they're both in generic form, has never been able to get a company interested in producing the combination, because again, both medications are so old, they're available as generic medicines. But he, in around 2000 or so, talked the drug company Eli Lilly into doing a study on weight loss with phentermine alone versus the phentermine with Prozac, and came up with this graph which shows that adding the Prozac to the phentermine increases the amount of weight loss that patients experience due to decreasing their hunger. But along with that, the thing is not mentioned nearly enough, is an accurate counting of the number of calories that people are eating per day, as well as knowledge of their basal metabolic rate, and at what level, if they overeat, they're going to begin to gain weight. And the only way that they can lose weight is to consume over a longer period of time fewer calories per day than is their basal metabolic rate.